Good day, everyone. My name is Maxine Aramonic P. Ramos, and I will be administering an intramuscular injection. The purpose of administering an intramuscular injection is to provide the medication that the client requires. In assessment, I should assess the following: the client's allergies to the medication, specific drug action, side effects, and adverse reactions, and the client's knowledge of and learning needs about the medication. Tissues, integrity of the selected site. Client's age and weight to determine the site of needle and needle size. Client's age and weight to determine the site and needle sizes. The client's ability of willingness to participate determine whether the size of the muscle is appropriate to the amount of medication to be injected. An average adult's deltoid muscle can actually absorb 0.5 ml of medication, although some authorities believe 1 ml can be absorbed by a well-developed deltoid muscle. The glutes medius muscle. In planning, the administration of IM injection is an invasive technique that involves the application of nursing knowledge, problem-solving, and sterile technique. Delegate to the unlicensed assistive personnel would be inappropriate. The nurse, however, can inform the UAP of the intended therapeutic effects and specific side effects of the medication and direct the UAP to report specific client observing to the nurse for follow-up. So here is our equipment. First is the client medical record. A sterile medication, a syringe and needle of a size appropriate for the amount and type of solution to. Here are the usual needle sizes or syringe sizes used in intramuscular medication. The antiseptic swabs and the clean gloves. And now for our intramuscular medication. First, I am going to start on my hand hygiene. I'm going to spray an antiseptic alcohol. And then check the patient's medical record to make sure if the Next, I'm going to check the patient's medical record to make sure if the medications that we are going to use are appropriate and on the right dosage for the patients, and we are going to administer it on the right patient. Okay, now let's start on putting on our medication. Again, we are going to use a tuberculin syringe. I am going to touch the barrel since this is a sterile packet. Before I will remove the whole syringe out of the packet, I am going to leave and remove the needle that I'm going to use for my patient on injecting the medicine. I'm going to replace the syringe needle on a aspirating needle. Before injecting the medicine or aspirating the medicine, before I will take the medicine out of the vial, I'm going to remove the cap of the aspirating needle and aspirate air on the same dosage of the medicine that I am going to take from the vial. Now that I aspirate the air, I am going to inject it on the vial, bevel up, going to inject the air on the vial. After injecting the air, I'm going to get the desired amount of medicine that I am going to use or inject for my patient. After I get the desired medicine for my patient, I am going to insert the cap of the aspirating needle. Remove the needle by twisting it and constantly putting it on the beam. And now I am going to put the needle that I am going to use for my patient. I'm going to put it tightly so it won't be loose. Put it on my tray. And then I won't forget to note on the medication card the medicine that I'm going to use, the dosage that I'm going to use, and making sure that it is the right patient that will receive the medication. And now that we are settled, we can now start on our intramuscular and now that we are ready to administrate the intramuscular medication. And now I'm going to prepare my client by introducing my name. And now I'm going to prepare my client on first introducing myself. Hello, sir. My name is Maxine Aramonic P. Ramos from BSN 1B NUST College of Nursing, and I will be your student nurse on administering your intradermal injection. May I know your name, age, and birthday, sir? I am going to ask his name, age, and birthday to make sure if he is the one that going to receive the right medication from the medical record. Since he is the right patient that going to receive the medicine, I will explain on him on how will the medication will produce a wheel, or sometimes called bleb, as it is raised by when the needle enters the skin. So it indicates how the medication will absorb on the capillaries into a general circulation. I'm doing this for facilitating the acceptance of compliance of the therapy by relaying the information that I am going to use and do for him. And now we are going to start on injecting the medication. I will now explain the purpose of the medication and how it will help using the language that the client can understand. Include relevant information about effects of this medication. Sir, ang medication po ito ay i-inject po namin sa muscles nyo. Dito po. Hinahawakan ko po kung saan. Ito po ay makakatulong para maibsan ang sakit sa inyong katawan. Okay po? And after the patient and the nurse facilitated acceptance of and compliance within the therapy, I will now select and locate clean the site. Select a site that's free of skin, lesions, tenderness, swelling, hardness, or localized inflammation, and one that has not been and frequently. If injections are to be frequent, alternate sites, avoid using the same site twice in a row. This is the exact location site of my injection. After I locate it, I will apply the clean gloves. After that I apply my skin glove, and after I apply my clean gloves, I will now clean and after I apply my clean gloves, I will now clean the site with an antiseptic swab using each circular motion. Start with the center and move outward about 5 centimeters. I will now transfer the swab and hold the swab between the third and fourth fingers of my non-dominant hand in readiness for the middle withdrawal, or position the swab on the client's skin above the intended site. Allow skin to dry prior to the injecting medication. In preparing the syringe, I will remove the needle cover and discard without contaminating the needle. I will inject the medication using Z-track technique, using the ulnar side of non-dominant hand to pull the skin approximately 2.5 centimeters to the side. Under some circumstances, such as for an enacted client or an infant, the muscle may be pinched. Holding the syringe between the thumb and forefinger, as if you are holding a pen, like this. Pierce the skin quickly and smoothly at the 90-degree angle. Insert the needle into the muscle. Hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back the plunger with your dominant hand. Aspirate for 5 to 10 seconds. If the needle is in a small blood vessel, it takes time for blood to appear. If the blood appears in a syringe, withdraw the needle, discard the syringe, and prepare a new injection. After that, I will now inject the medication. After the injection, wait 10 seconds. I will now withdraw the needle smoothly at the same angle of the insertion. I will apply a gentle pressure at the site with a dry sponge or dry cotton ball, and I will ask the patient to not necessarily massage the area of the site of the injection. After that, I will remove my gloves and now we will perform a hand hygiene. I will now document all the relevant information, include the time of administration, drug name, dose, route, and client reactions, and assess the effectiveness of medication at the same time it is expected to act. After administering an intramuscular medication, we should evaluate the client's response to the testing substances because some medications used in testing may cause allergic reactions. If allergic reactions occurs, epiperin may need to be used. Evaluate the condition of the site in 24 to 48 hours depending on the test measured the area of redness and induration in millimeters at the largest diameter and document findings.